Sometimes it is difficult to see all of the information that we need on an FMX or a full mouth series. So we have to turn to a different set of images. When we're looking for impacted third molars, jaw fractions, any other type of large lesion, extraoral radiographs or extraoral imaging is going to be a little bit more helpful. So extraoral images are ones that are taken outside of the mouth. With these, we are able to view large areas of the skull and jaw. There are many different types of extraoral projections or extraoral films, and the type that your doctor may prescribe is going to be based on what information we need to find. So what are some things we might be looking for, or what do we use extraoral imaging for? One thing is to evaluate large areas of the skull and jaw. When we are trying to evaluate growth and development, evaluating impacted teeth, evaluating the temporomandibular joint or the TMJ, and it can also be used for other things like detecting diseases, different lesions, other conditions of the jaw, and also to evaluate trauma. Or in the case of some patients, if they have trouble opening their mouth, an extraoral film may not be the most diagnostic, but it will be the best option because at least you will have some view of what is going on with this patient's mouth. Now, as I just mentioned, it might not be the most diagnostic because with our extraoral imaging, sometimes the images are not as sharp as defined as with our extraoral imaging, some of our images are not as sharp or defined, so it renders it just a little bit more undiagnostic in certain situations, like for detecting caries. But otherwise, if our patient is having trouble opening, this may be our only option. What's our equipment? We need our X-ray unit, and a standard intraoral X-ray machine can be used, but it may have something called a cephalostat, which is going to be a device with an extension arm to be able to use a panoramic machine. You will also be needing your image receptors, your digital sensor, or your film-based, which is your traditional. And with your traditional film, you're also going to have screen film, intensifying screens, cassettes, and a grid. And we'll get a little bit more into that here in a moment. So the first type of extraoral projection we'll talk about here is a panoramic. And a panoramic is a wide view of the maxilla and mandible and the surrounding structures, and it is all located on one film. So this is an extraoral technique with one projection. And as you can see from the sample here, it does not show the details very well. So if you're trying to detect caries on this film, you may have a more difficult time than with using a PA or a bite wing. So how does a panoramic work? There is a receptor and the X-ray tube, and they rotate around the patient's head simultaneously. So you can see here in the picture, here's our patient, and it is saying here is our receptor, so it is rotating around the head. The tube head goes around the head as well. So one is rotating around this side while the other is rotating around the opposite side. So the X-ray tube goes one direction, the receptor in the other direction. The patient may sit or stand while this is occurring, but it does depend on what type of machine. So there's a part called the rotation center. And this is a point around which the receptor and the X-ray tube head rotate. Think of this as the axis or the pivotal point. This rotation center is going to change as the receptor and the X-ray tube rotate around the patient. And what this does is it allows an image layer to kind of conform to the shape of the dental arches. Because those arches have a bit of a curved shape to them, that rotation center changing allows the images to just work its way around the arch so that there's minimal distortion. So while it is doing that, while that rotation center changes, it's going to create this area known as the focal trough. The focal trough is, again, it's a curve, so it's a three-dimensional curved zone where you can clearly see the structures. So it's this specific area of the image layer where we can see what those parts are that we need to see within the mouth. The focal trough has been known to have a horseshoe shape, and inside that horseshoe shape, or the three-dimensional curved zone, that's where the images are going to be more defined, or the structures are going to be more defined than the ones that are located outside that curved horseshoe-shaped zone. The specific equipment that we need for a panoramic film, again, we're going to have the X-ray unit, which is the X-ray tube head, and is going to be similar to the intraoral tube head. It is going to have a filament to produce electrons and a target to produce X-rays. It's also going to contain a collimator, but it's slightly different from the collimator in an intraoral tube head. With a panoramic collimator, it is going to be a slit, a narrow vertical slit. Its purpose is the same. It is still to restrict the size and the shape of the beam, but it is just a little bit different shape. The next part is the head positioner. And this is going to have a chin rest and a notched bite block to stabilize the dentition. So it has like a little cushion where you're going to have the patient sit their chin and they will bite onto the bite block where there's a little notch, and where that notch is, your patient would bite into with their two front teeth. And that just helps stabilize everything, keeps their head still while that machine is rotating around their head. There are also lateral head supports to stabilize the head vertically and horizontally, and a forehead rest. And last, we are going to have the exposure controls. The manufacturer will determine the MA and the KV, but it can be changed. And being able to change the MA and the KVP will help accommodate for your patients that have different sizes. The exposure time, however, that is fixed. That is something that cannot be changed. And the exposure time is also going to be based on the type of image that your machine is taking. We have image receptors, which is a digital sensor if we are using a digital system, or a PSP plate if we are using a digital system, or we have film. And the film is going to have different things to go along with it that make it just a little bit different than your intraoral films. This type of film is called screen film, and it is sensitive to light from something that we call an intensifying screen. And that film is placed between two intensifying screens and then it's placed into the cassette. So right here we have three parts to our panoramic film. We have the film itself or the screen film, and we have something called an intensifying screen that the film slides between, kind of like you're putting a piece of paper in an envelope. And then that intensifying screen is placed into the cassette. And the cassette is like another envelope that you would be putting the intensifying screen into. So we have an intensifying screen. What is that? An intensifying screen is a thin sheet or layers of different types of fluorescent material. When the X-rays hit the intensifying screen, a portion of it is then turned into light, and the light exposes the screen or exposes the film. This type of film uses visible light instead of X-rays to produce a film. So we need that intensifying screen that helps turn our X-rays into visible light. So when the X-ray hits the screen, the X-ray hits the intensifying screen, a small part of it is absorbed, and then a portion of it is converted into light. The light exposes the film. And we work with two different kinds of intensifying screens. The first one is a calcium tungstate, and the calcium tungstate screen is going to emit blue light. This also means that it is blue light sensitive when you are using blue screen film. And the second type is rare earth screen, and they are sensitive to green lights. I'm going to back up and do the intensifying screen, calcium tungstate and rare earth again. I don't quite like the wording that I think I used, so I'm going to back up and do those again. There are two basic types of intensifying screens that we use, and the first one is a calcium tungstate film or a calcium. Blah, blah, blah. Okay, let's try this again. There are two types of intensifying screens that we use, and the first one is calcium tungstate, which emits blue light, and rare earth screens, which emit green light. The rare earth screen uses less radiation, so it is recommended in panoramic radiography. There's less exposure for the patient. And each screen emits a different kind of light, so you have to make sure that you're using the right kind of film. It must be paired with the correct film. So a calcium tungstate screen is going to be paired with blue light sensitive film, while a rare earth screen is going to be paired with a green light sensitive film. So the next part would be your cassette. And a cassette is something that just holds the extraoral film and the intensifying screen. So this is back to my analogy about the envelopes. The cassette is the outer envelope. So you have the film that slides inside the first envelope, which is the intensifying screen, and then the intensifying screen envelope slides inside the cassette. Cassettes can be what we call rigid or flexible. So rigid meaning it's got like more of a hard case, and flexible, of course, meaning flexible. And they can be curved or straight. Whichever kind that's used, it must be light tight. These screens or these films are sensitive to light, more sensitive to light, so they must be light tight. Each one will be marked with right and left for orientation purposes. And it could also contain a place to put the patient's name and the date and any other special labeling that the dentist may like to have, such as the dentist name and the location. And this is just an example. This is just a sample here of two different types of screens. I'm sorry. This is just a sample of two different types of cassettes. So we have this one here, which would be the rigid, or this one here, which would be the flexible, and this one over here, which is the rigid case. So you can see how if this little gray line, if this were the film, it sits inside of this white envelope or the intensifying screen. And then that screen or that envelope fits inside this flexible vinyl case. And the same thing over here. We have the film that sits inside of this envelope, which is the intensifying screen. And then when it closes, that is the other envelope closing it in. Our patient positioning for the PAM, you're going to have your patient stand as tall as possible. This is, of course, after you have put on the lead apron to help protect the patient. And in this case, we do not use a thyroid collar. This is recommended to not use the thyroid collar because the panoramic, when it's moving around the head, I'm struggling on this one tonight. I'm so sorry. Okay, let me back up. For your patient positioning on a panoramic, you want to start by putting the lead apron on the patient. Of course, this protects them from radiation exposure. This lead apron is often a double-sided lead apron, so it's going to protect both the front and the back of the patient. And this lead apron will not contain a thyroid collar, or the recommendation is to not have a thyroid collar, because it's going to block part of the X-ray beam and it's going to leave off important diagnostic information from that X-ray. So once the lead apron is ready to go, you are going to instruct the patient to stand as tall as possible. You want this to be very straight. You want their spinal column to be very straight, because if it's not, a white kind of shadow can appear over the middle of the radiograph, and that might block diagnostic information that's needed. Then you will instruct the patient to bite on the groove that's in the bite block. This groove is what helps align the teeth and keep them in that focal trough. That's that curved area or that horseshoe-shaped area that allows structures to be seen clearly. You then position the mid-sagittal plane perpendicular to the floor. And that mid-sagittal plane is the imaginary line that divides the patient into their right and left sides of their face. If that plane is not perpendicular and their face is tilted in either direction, there will be a distorted image on the final product. There's also another plane that you want to take into consideration, and this is called the Frankfurt plane. And this is the imaginary plane that goes from the top of the ear canal to the bottom of the eye socket. And this plane needs to be parallel to the floor. And so that makes the occlusal plane be positioned at the correct angle. So two different planes you want to kind of remember. Mid-sagittal to be perpendicular and the Frankfurt plane to be parallel. Once those two planes are set, the next thing you will do is you will ask the patient to lift their tongue to the roof of the mouth and close the lips around the bite block. You might suggest that they swallow. As they swallow, they'll feel that their tongue will rise up to the roof of the mouth. Then they'll know and you'll know that they're in the right position. Let them know that that tongue needs to stay at the roof of the mouth for the entire exposure, and the lips need to remain around the bite block. Instruct them to stand still while the machine is rotating. And once that rotation has come to a stop, you will be able to have them step out of the machine and remove the lead apron, and then you will be able to go ahead and process that film. There are other projections that can be used in the there are other projections that can be used with the extraoral technique. And one of those projections is lateral jaw imaging. The purpose of lateral jaw imaging is to examine the posterior region of the mandible. And this type of image is useful, but it's important to keep in mind that a pan or a panoramic is more diagnostic. It's preferred. A standard X-ray unit can be used, and there are two different techniques. There's the body of the mandible and then the ramus of the mandible. With the body of the mandible, the purpose of it is to evaluate impacted teeth, fractures, and lesions. It shows us the premolar and the molar region and the inferior border of the mandible. So, how is the receptor or the film placed for this type of projection? Flat against the patient's cheek and centered over the body of the mandible. So that film is flat up against the patient's cheek and centered over the body of the mandible. So you have to know your anatomy there and find the body of the mandible and put the film flat against the cheek. Keep a note here that the receptor or the cassette that is holding the receptor should be parallel with the body of the mandible as well. The patient will hold the receptor in place. And then the head is tipped at 15 degrees towards the side being radiographed. Here's a little sample of the body of the mandible projection. You can see this is just an intraoral X-ray unit that's going to be used. Here is the receptor along the side of the face. It is parallel, and that patient is tipping their head towards the side being radiographed. And then note here, the chin is extended and it's slightly elevated. The other part of the lateral jaw imaging is the ramus of the mandible. And it is used to evaluate the third molars, large lesions, and fractures. This will be used to find fractures that may extend down into that ramus. And it will show the entire ramus from the angle of the mandible up to the condyle. Your receptor placement, again, it's flat against the patient's cheek and will be centered over the ramus of the mandible. It must also be parallel with the ramus. The patient will hold the receptor, and the head is tipped 15 degrees towards the side being imaged. So it looks very similar to the body of the mandible. It is just the placement of the film and the placement of the tube head. And so you can see based on the picture here, or based on the radiograph, it is a little bit different look than what the previous one was. And the last projection we're going to talk about is called the lateral cephalometric. And this is used to evaluate facial growth and development, trauma, disease, and developmental abnormalities. It will show us the bones of the face as well as the soft tissue profile. Sometimes a filter will be used to remove some of the x-rays that pass through and onto the face. And when this is done, the resulting radiograph will have a greater outline of the soft tissue of the face. The receptor and the cassette is going to be placed perpendicular to the floor with the long axis of the case positioned horizontally. The left side of the patient's head will be next to the receptor. The head, though, must run parallel to the receptor. So keep in mind with that mid-sagittal plane, the mid-sagittal plane should be perpendicular, and the mid-sagittal plane will also be parallel with the cassette. So here's an example of a cephalometric. So again, we have the X-ray unit, the tube head. Patient's left side is next to the film. It's parallel. Mid-sagittal plane is perpendicular to the floor. And then that central ray is directed right at the film. It's perpendicular. And this is the resulting image. And you can see here pretty clearly defined that soft tissue. There's the lips, the chin. Let's do our little review. The zone in which structures are clearly demonstrated on a panoramic radiograph is called A, the focal trough, B, the rotation center, C, the ghost image, or D, the mid-sagittal plane. The correct answer is A, focal trough. A thyroid collar is not recommended in panoramic radiography because A, it is impossible to sterilize the thyroid collar, B, there is a relatively low dose of radiation to the thyroid gland in panoramic radiograph, C, it blocks the X-ray beam and obscures information, or D, all of the above. The correct answer is C, it blocks the X-ray beam and the correct answer is C, it blocks the X-ray beam and obscures information. Number 3, a rare earth screen emits what kind of light? A, red, B, blue, C, yellow, or D, green? The correct answer is D, green. And when positioning a patient for a panoramic radiograph, the mid-sagittal plane should be blank to the floor. Even, B, parallel, C, next to, or D, perpendicular. The correct answer is D, perpendicular.